Good evening. How y'all doing?
Good.
I'm gonna go ahead and get this special council meeting started. I'm gonna ask that, the city clerk, will you please call the roll?
Yes, sir. Mayor McClendon,
Present.
City Attorney Stevenson, Councilor Pack,
Here.
Councilor Crum,
Either.
yeah. Councilor Harris,
Here.
Councilor Holt,
Is that you crying or someone else in the background?
Councilor Hutchinson, Councilor Muhammad,
Present.
Councilor Monday,
No, it won't go to
Councilor
sleep.
Murray,
Here.
Councilor Pulliam,
Here.
Councilor Wheelis.
Here.
Thank you, sir.
Thank you.
We have 7 out of 10 that's here, that's present. The only item that we have on the agenda is approving the insurance before the deadline of tomorrow with Aetna Insurance. That you all, we had an insurance committee meeting, and Mr. Councilman Kroon made the recommendation, and it was second to refer that we accept the bid back to the full body council, and that's why we're here today. So I'm gonna ask for a motion to approve.
You have a motion to put it on the floor, yes?
Yeah. Can I get a second?
Second.
Any discussion?
All right. I went back and looked at, I'd gotten a printout of the 2019 claims for the full year, which was just a shade over 2.1 million. Then I went back through the P&L from 2019, or the revenue expense sheets, and the city paid in approximately 2.5 million in premiums. Them operating on a 20% margin, probably I'd say most insurance companies try to do that if at all possible. My personal belief is with them going ahead and giving the credit, they are on top of the numbers more than anybody. So they wouldn't be given the credit if there wasn't a little bit of, to me, cushion there. So, and again, by law, they have to give you a refund based off of a certain percentage if claims aren't a certain number. So going up to 5.3%? 5.8? Okay. Based on everyone I talked to, that's just unknown. COVID, everything else, nobody knows when the vaccine's coming out, so I guess everybody's got a little cushion. Is it better for us to go ahead and deny this and go ahead and bid it out? Well, that's a $10 million question. I always had no saying you can take the one in the hand versus two in the bush. If you don't accept it, premiums come in much higher. Comes a budget issue. How much do you want to pass on to employees? How much can the city go ahead and absorb? If you go ahead and take what they've offered, can the city absorb all that without any pass to the employee? Probably. The last time I think we raised theirs $2. You may raise it $2 again. I'm not for sure what the council will want to do. But we'll need to get with Finance Director Torrey as we get into latter part of October, early part of November, finish putting the budget together so we can get it to the council by 11:30. And we'll see how those numbers will flow out. But, that's just one person's opinion of where we're at this point.
Also, well, you let the record reflect that Councilman Monday came in. Comment for you?
Oh, yeah, one of the things I know we was talking earlier about the X number of employees that could take, I guess pass this insurance up and get a supplement. I mean, have y'all talked to anybody to see who all was willing to do that?
Well, let me answer that question, Councilman. One of the things that I'm asking you all on making the decision, don't even look at that.
Okay, that's where I was going, okay.
I mean, if all 37 decide to take it, that's a plus. But all 37 don't have to take it, and I don't want us to make a decision based on thinking that all 37 is going to take it, and then that's why we made.
And that's why I brought that out, because I'm just saying, that was the conversational piece when we was talking about this, and so I just wanted to make sure that everybody was aware of it. That was just part of the conversation that we was having.
What?
And I understand where we are today, and my thing is just like, and I just tell it like it is. Only problem that I have is, of course, you know, we talk about this and bringing this out ahead of time, and I know everybody said, well, you can only get so many, you got to have so many months, but of course, you know, you still can go back and look at past history, and we didn't get a chance to do that. And also, you know, of course, and I understand the young man that's our agent right now, and I don't have a problem with that. But sometimes, and you know, this insurance have been on the rise for quite some time. And last year, you know, we opted to go ahead and not bid it out, which I was for that. And so this year we said we would bid it out, which we didn't. And that was one of the reasons why I thought that we was doing this ahead of time so we could get whatever broker that wanted to be involved in this, in which we didn't follow through with that. So now this is where we are. This is why we're here today, because we didn't actually follow through with it.
Well, as far as bidding out the insurance, you're right, until we have enough claims data. My understanding, the insurance companies don't want to bid in mid-year, knowing they've got another 6 months, they have to honor that premium until the new year starts, and their actually plan would go into play. With COVID, it has thrown everything in a bit of a turmoil as far as trying to really do some serious planning ahead of time. I think after we get to, if any of the employees decide to switch, it's not like you're going to rebid the plan. That's really, I don't think, an option to do it in March or April. So that rule will kick into play. If there's excess premiums over a certain dollar amount, they have to refund them anyhow. Now, at the end of June 30th, we'll have all the 2020 data. And you're right, July 1st, we need to sit down and say, okay, we've got to do this and make sure this happens. Will they bid in September, August? They still may say, I'm not going to bid until November. And that's fine, and then we'll just have to wait for the bid to come in, but you're right.
Well, see, one of the resources that we're not using, and I think we should start looking there as well, because, you know, the municipal league is there to help us as well. I mean, and the things that we need to start looking into, not only that we got the National League of Cities who still have the same, I'm talking about they could put something together to help us as well. Now, you know, this year, like I said, we are where we are today, and if they're gonna save us a little bit, then I guess, you know, going forth with this, I guess would be okay, you know. But I just have to express you know, how I feel the way that I feel. Because number one, that's why I was trying to get us to get ahead of this ball game, so we wouldn't run into, well, we can't get this, we can't get that. So, but I'm okay.
Yeah, you know, when we had this conversation earlier, we had it late last year.
Yeah.
Again, the virus has really tied our hands behind our back to a certain degree with actually being able to get, as I still don't think the insurance companies know exactly how they're going to handle 2021. And my understanding of what they've been doing primarily now is almost paying 100% of anything that's COVID related. So, I mean, there's no telling what that number is going to be. So, you're right. I would always love to have everything done beforehand. You know, just nature of the beast. You just want to know you got the best deal you can get. But
well, let me ask a broker one quick question. Okay, I know they're talking about this new stimulus bill, and I don't know how abreast you are on that, but at the same time, okay, like this new stimulus bill that they're talking about coming up with, I don't know if you've been keeping up with that. I mean, are they looking
Not
at
enough to speak on it.
Huh?
Not enough to speak on it.
Okay,
I'm
I was
pretty
just trying to see
educated
were they
enough.
planning on putting anything. I'm just saying, you know, like you said, now they paying 100% when you go to the hospital, you know, different.
What I do know is, both of y'all are right on, about with COVID. So they don't know what they're gonna do, because right now the government says nobody, me civilian, doesn't have to pay any COVID related, any COVID. So if I go in the hospital with COVID and have a heart attack, I don't have to pay that. Well, insurance companies, as of today, have not paid anybody all that money. They don't know what they're going to have to. Somebody's going to have to.
Yeah.
Probably be them. So you may be looking at, I don't know. I don't want to.
Okay.
I don't know the future.
well, so unfortunately, we won't have some definitive answers until after the election's
Well,
over with.
and then here's
Well, that
one.
may be
That
so.
game that's being played right now is driving all of us a
And
little
here's
bonkers.
one thing I can tell you definitively. I know you may think it's just me trying to get you or something, but they're not going to ever give you, I'm old enough to never say never. the way that system is set up right now, you're not ever gonna get a competitive quote unless that whole model changes in July. Because there's not, every year it's a new contract. So in other words, there's new sick people. And like, it makes so much sense to say, well, the 6 months of this year and the 6 months of last year, that's a whole year. Why does it matter? It does to them.
Well, see, the only thing that I'm saying is here is, you know, we have resources out there that are supposed to be helping us save money. That's what I'm saying. We have those resources.
Oh,
and
and
I'm
you know
just saying, we haven't had an opportunity. We have not, because ever since we was with them once before, but we left them and started self-insured, then we went to this, went to that, and we never went back to check to see. I'm just saying, would it help? Would it help? So that's the only thing that I'm saying. We are where we are today, and I'm fine with it. I mean, because I guess we got to move on, and then we can deal with this next year. And I'm just hoping next year we do things a little bit different. That's what I'm saying. I'm talking about look at the options. Not saying, I mean, we still might end up with the same broker that we've been doing business with, but at the same time, let's look at our option, because the insurance is not getting cheaper. It's going up and up and up. And then again, that's something that we have to, look at.
I know, during the year, I know that the insurance worries has been the biggest worry that we have had.
Oh, yeah.
Having no idea of what we're gonna be paying at this point. But I do know with this deal, it do at least keep us where we was at this year. You know, we can't gamble and save 500,000, just throwing out a number, or end up paying another 500,000 more. So it just really the best decision of what the council, what you all come up with.
Well, I'm fine. I mean, where we are, I mean, the thing of it is, like I say, the resources that we know that we could have used, we didn't. And that's nobody's fault, because probably no one ever thought about it, because we haven't used the municipal league in years, because we know we went to the self-insured deal, and that definitely didn't work out for us. So that's how we ended up where we are now. So, okay.
In 1 year.
And just so you'll know, if you get any questions from your constituents, or just so you'll know, the municipal league they quit bidding municipalities your size because they're way too expensive. They don't even have a group this size on health insurance. And so what you guys asked me to do last year was, to get on this, and so you didn't go through the bidding process because you don't want, when I say you, I'm just saying you guys, not me, because of the hassle and so, but you did go to every carrier. You couldn't have done anything different. They're just not gonna give it to you.
Well, I'm gonna have several questions on this, Medicare too.
Yes, sir. I'm gonna give you his phone number.
Number one, G only pays, it does not pay the medical, medicine. So you'd have to find an insurance for that part of it.
It's in.
There's a B
I believe it's D.
and a C.
I believe it's D.
And only G pays
Yeah.
for a certain percentage. So
Yes.
you'd have to go to Medicare and pay it yourself on the other.
No, sir, it's all in that supplement. It's three things.
Yeah.
It's everything.
It covers everything?
Yes, sir. Now, I wanna be
No.
careful when I say, no,
Not
sir,
what
it
I'm
does not
reading
cover
it does.
everything, but when me and you are meaning the same thing when we say everything. What you're describing is not accurate. You
Well,
don't have to do that.
keep this in mind before we get all the way off. If you don't want the Medicare, just stay on the regular, have everything the city has.
Well, I think we need to look at it, just see what,
But you're
I
gonna
mean,
be
sure,
surprised.
sure,
Your
you'll
employees
be able to do
don't
that.
wanna do that.
I would like to ask one
Yes,
question.
ma'am.
Are we potentially passing this on the fact that there are 37 people who may?
No, ma'am, I believe the
Okay.
mayor's instructed
That's
everybody.
what I said,
Don't
you
even
know.
think
I
about it.
know, but I have to think about it because people
sure.
ask questions. I know it's not saying that 37 people are going to accept it. I'm saying is, are we basing this passage on perhaps that 37 people may? Or are we
No.
just basing it on the fact that it is there for whomever may want it?
Ms.
Well,
Muhammad,
it's not even part of the.
I'm gonna ask to see the council to complete the 37 people out of this whole equation.
forget that right there.
Just totally forget it.
We just passed the insurance.
Yeah, you voting on the insurance in the AA. It's the 5.8, but the $83,000 discount to keep it down to a 3% increase. That's all we vote.
And I would encourage you to add to that, if you think it's willing, that the employees have the opportunity, if they want to.
Right,
to
that's what
go,
I was
because I'm telling you,
asking.
it's a bit, I make less money every time somebody goes to there. So I'm not trying, it's a way better deal.
Right, right.
It is.
That's why I was asking you, and the reason I said the 37 is because I wasn't the one who first mentioned it. That
That's
was a figure that was thrown out at the
That's
very
right.
beginning of the discussions a few meetings back.
Yeah.
So I was just trying to get the long and
Yes, they're
short
not
of what
tied-
we're
they're not
doing.
tied together in any way, as far as you're
Okay.
concerned, this is just you're voting on your health insurance.
Right,
What you
right,
got.
right. That's
No
what I wanted to
Medicare
know.
neither.
That's all I wanted to know. If
Yes,
you're
ma'am.
just basing it on
Okay.
37 and just basing it on the fact that if you want it, it's there for you.
That's exactly right.
Okay,
If
that's
you
all I
want-
wanted to know.
And and if they do it, that's about an additional another $83,000 in savings, if all 37 people decide to do it.
Now, all we're doing today is taking the 2020 plan and moving it to 2021 based off of a known increase. You know,
Right.
that we know of right now today what that's going to be.
You said a known increase, right?
A known increase. We know it's going to be 5.8%. We know we're going to get the $83,000 credit. We know it's going to be net out to about a 3% increase. We know it's approximately 400 employees plus the ones that are on family coverage. That's the exact same ball you carried in 2020, you'll be carrying in 2021, other than the fact that after all this is settled, some of our employees have an option to make another choice. But it has nothing to do with what we're doing today. Now, will it have something to do with 2022? Yes, because those claims are being diverted from your plan to another plan. Fewer claims, lower premiums. It's just the way it is. But we won't know that until 2022 or 3, exactly how much it plays out.
And that 5.8 compared today, well, what's that's gonna bring us to? Same, it's gonna increase 5.8, what's?
Well, you're actually gonna get the 83,000 discount, which brings it just a 3% increase.
Oh, okay, okay.
Yeah.
That
No.
83,000 discount is based on what?
That 83,000 is based off of
Choosing it.
not bidding the plan, and insurance companies have this down to a fine art. There's no ifs, ands, or buts. They have the systems and the software to get it pretty darn accurate. I truly believe that we're already probably going to come in less than our claims experience based off the law. So they're probably going to have to issue a refund anyhow.
I think you will get it.
And I think this is just a precursor to what they know they're going to have to do come March or April. So they're just getting a little bit ahead of the game. And it was an attractive offer to hopefully you'd stay with them. That's basically what it boils down to. But again, I'm kind of bad about, I know where we're at. I don't know where we'll be if we go the other route. So,
And everybody be clear and circle back on it, that 80,000 that Councilman Katz talking about has nothing to do with if the 37 people do it. That's just him saying, stay with us, we'll give you this discount. So if the 37 people leave, that's an additional. It has nothing to do with, you're gonna get if you pass this, you're gonna get an $80,000 credit for that.
at the end of the day, the math's about right. You're looking at about a $75,000 difference in premium cost from 2020 to 2021, based off the 3%. So,
You said $75 increase?
75,000.
Oh, I thought you said 75, okay.
Oh, no.
That would be great.
Councilman Pulliam, any more questions?
No, I'm finished.
Councilman Wheelers?
I'm fine.
Councilman Murray? Councilman Muhammad?
I'm thinking, but I'm okay.
Councilman Holt? Councilman Mundy? Councilman Cat?
I have no more questions.
Councilman Croom? He got the baby on his head. Councilman Croom, did you have any questions or comments, thing you need to get cleared?
Might be muted.
I think you muted it because the baby was real active.
All right.
I can't hear you.
Councilman, we can't hear you, you're muted.
Councilman Croom?
Hello?
Councilman Croom, hey, Do you have any
Can you hear me
questions?
now?
Yeah, I can hear you.
I made a comment and I said this is about the third or fourth time that we've discussed the insurance, and I hear a lot of repetition in the questioning and the answers. And I was just saying, hey, let's go ahead and get this approved so we can move forward.
That's what we're gonna do.
Well, I got
reason we're here today.
I got a motion and a second.
I'll make a motion.
I got a motion and a second already. If there's no further discussion, I'm gonna call for a roll call vote.
Counselor Cat,
Yes.
Counselor Croom,
Yes.
Counselor Harris, Counselor Holt,
Yes.
Counselor Hutchinson, Counselor Muhammad,
Yes,
Counselor Monday,
Yes.
Counselor Murray,
Yes.
Counselor Pulliam,
Yes.
Counselor Wheelis.
Yes, ma'am.
Thank you, sir.
We have 7 yeses, it passes. That's all the
Be on
business.
ESPN, announcing.
That's all the business that we had this time.
Make
So
a
I'd
motion
like
to
to-
return.
I got an announcement to make, if y'all don't mind. I'm a great grandpa again.
Oh, congratulations.
James Curtis Holt the fourth.
yeah.
Congratulations.
Congratulations.
During this meeting, can I get just 3 minutes with the council?
Okay.
3 minutes for the council people. I got a motion and a second. All in favor, aye?
Aye.
Opposed? We dismiss.
Now,